Good afternoon, everyone. Greetings. Today is Friday, June 19th. Welcome to our media update. We're happy that you're joining us again to get current information on what's happening related to COVID-19 in Eau Claire, to hear the most recent data, and to make sure that your questions are answered. I'll start today by talking about celebrating Juneteenth today. Juneteenth is an important day in American history, and it's the oldest holiday celebrated related to the emancipation of slavery, to end slavery in the U.S. In 1865, that happened when 2.5 years after the Emancipation Proclamation, the word was received in Galveston, Texas, that slavery was ended in the U.S. That happened many, many years ago, but still is a really important thing to pay attention to and celebrate. It has special meaning this year because of the recent events that have happened, that have highlighted the racism that exists in our country, and the racism that exists in outcomes related to COVID-19. I really encourage you to find a way to learn about this day, celebrate this day with those people that are really importantly needing to celebrate. All of us need to pay attention and learn. In Eau Claire, we're really fortunate that there's been a whole day of learning that has been organized, and if you aren't aware of that, certainly a very quick social media check or any of our media site checks will, I'm sure, find that connection locally. One of the things that I heard today that I think is important for all of us to remember is that race is not a determinant of health. Racism is a determinant of health. And I think we are healthy or unhealthy because of policies that can make a difference. And one of those things that we all need to pay attention to, and including in this pandemic, is how racism impacts people's outcomes. On Sunday, we also celebrate Father's Day. Angie Weideman from Chippewa County was here on Monday during our media briefing talking about celebrating safely. So I am again encouraging people to find ways to have a safe and celebratory Father's Day this weekend. To all those who are or who have been over their lifetimes a father or a father figure for others, happy Father's Day. I'm sending my special Father's Day greeting today to Grandpa Jerry. Grandpa Jerry is someone that is loved very much by my family, but also someone that we haven't been able to see in a very long time, and only talk to him via the phone and other social media outlets. So a special Father's Day celebration to Grandpa Jerry. All of us, please remember to celebrate safely, whether virtually with extended family or in person with the people that you live with. Find ways to connect with family members this Father's Day. And if you meet in person, do it in ways that are more safe. Pay attention to staying home if you are sick. Even though it's Father's Day, you can celebrate a different day if you need to. Wear a cloth face covering if you are meeting up with someone. Keep distance. That 6-foot distance is one of the most important measures that we can take. Meet outside rather than inside, and make sure you are doing things to keep each other safe. We love our fathers. Some of us may never be super sick with COVID-19, but we could get others sick, people that we love, and this is an opportunity to really show one another how much you love them by keeping each other safe. Thanks for thinking about that this weekend and in weekends in the future. Today we also have Luke Feedy with us again to really talk about the critical issue of staying mentally healthy, and he will share a couple of thoughts with us after I share some data. The state update on COVID-19, we now have 444,751 negative tests for COVID-19, an increase of almost 11,000 tests that are negative. The total positive counts for cases of Wisconsin residents is now at 24,154, an increase since yesterday of 278. Of those, People positive, 3,177 have been hospitalized, an increase of 17. And we have 11 more Wisconsin residents that have died of this disease since yesterday. We're at 731 people that have died of COVID-19 since it started. A couple of state updates. Today, the Wisconsin Interscholastic Athletic Association, otherwise known as WIAA, released guidance for grades 6 through 12 athletic activities, particularly as they start back this summer. Athletics are a critical part of being physically, mentally, and socially healthy, and it's important for our student athletes and for athletes in all ways to have safe and healthy ways to be doing their sport. WIAA released that guidance right before I came up here. We're still digesting it and working through what that exactly means, but we've been in partnership for many weeks with our school administrators in high schools across the county and working through things like how do we do any of our school operations safely, including athletics. That 16-page document will be reviewed with all of those partners, and we will be working with them to look at what is the current risk of disease in this community, and what are those things that can be done in a safe and safer and more healthy way given COVID-19. Some things that we can expect to see and that are recommendations in this guidance include the use of cloth face coverings, the screening, as we do for many settings, of ill coaches, players, and others that are in that situation. The limitation of groups that are practicing together or playing together, again, keeping separation between groups, and other measures to really increase the safety for students and for others participating. We'll continue to work with those school districts, and I'm sure we'll have more information on the details as that rolls out in our area. In Eau Claire, we are continuing to see an increase of cases, and so certainly as we talk with schools, both K through 12 schools as well as the UW Eau Claire and CVTC, we are paying attention to the disease spread as well as those measures that can be taken to make things a bit more safe. In Eau Claire, our data, we are now at 6,826 negative tests for COVID-19, an increase of 156 negative tests since Thursday. We now have 151 positive cases for COVID-19, an increase of 2 since yesterday. And we're at recovered cases of 128. We are this week, and our numbers will show even increased numbers today after the state data was pulled, is showing more outbreaks and is showing more cases. So we are seeing rapid increases again, and we need to let the community know that disease is spreading. We also know, as we've reported on our website with our measures, that many of those cases are ones where it's not known where that individual got the case from, where they became positive from. So that community spread of disease is real in this community. Making sure that you are doing things to not spread disease if you are a person that is symptomatic, that you're getting tested, and that you are staying home is critically important. And taking those measures to prevent spread of disease by wearing a cloth face covering when you leave the house and you're in interaction with other people, keeping a safe distance from everybody, and really working hard to keep that 6 feet apart, which is one of our most effective ways to stop spread of disease, and not having large gatherings where that spread is more likely to happen. All those things are things that we can do, and we can make a difference in this disease slowly spreading in this community rather than spiking. We've seen big spikes in other counties in Wisconsin. Certainly, if you're watching the media for a sister county in La Crosse, they are seeing large spikes this last week of disease, and they were at a point where their cases were well below ours, and now they are at a point where their cases are above our cases. So it can happen quickly. We know that is true, and it's important that we're working together and continuing to work together to keep that disease spread as low as possible. So I'm going to turn it over to Luke Feedy, and he is going to share some comments, and then I will be back to share a couple of additional pieces of information and answer questions.
Thank you, Liska. Happy Friday to everybody listening. I want to take a moment and just again say that Eau Claire County Department of Human Services acknowledges the historical importance of Juneteenth, and we want to wish a happy Juneteenth to all those who celebrate. So with quarantine and isolation, we have found ourselves struggling with feelings of loneliness, anxiety, depression. This isolation can exacerbate a lot of these things. These feelings can also have an impact on our physical health. It's been shown to be a contributing factor in cases of coronary heart disease, stroke, even premature death. Now, I don't want to sound fatalist when I say this, but we do want to acknowledge the importance of physical health and mental health and how the two relate to one another. There are a number of different things that we can do to combat feelings of loneliness and our psychological distress during this time. I'm going to offer a couple that you may already be doing, that you want to continue to do or potentially bolster, or perhaps new things that you want to try. So the first is keeping a schedule. Many of us have had to modify our schedules and continue to adapt to changing day-to-day needs throughout this pandemic. Keeping consistency in our schedule can be challenging. And having some consistency within our schedule. So putting things into place where each day we know what we're going to do, we can follow some normalcy and some consistency can help the day feel much more predictable. It can help with giving us an idea of what each day holds. It can feel much more grounded as we move throughout our day. The second tip is to stay up to date with information. Keeping up to date with the latest information from public health may give you an edge when it comes to protecting your mental health. Many times our anxiety is driven by the fear of the unknown. And when we have a fear of the unknown, we can lack some direction. Having guidance from public health and from other news sources can help us stay up to date and continue to provide some level of direction and guidance. The third is be active. And with the weather changing and it being nicer out, this has gotten a bit easier for all of us. I recently heard my friend refer to the weight gain during this pandemic as gaining the COVID-19. Much like the freshman 15 that some of us experienced in college, the change in our routine and structure can lead us to put exercise on the back burner. Our mental and physical health are, again, very closely tied to one another, and we can continue to armor ourselves against distress by being active, setting small things, small goals. So maybe it's getting out for a 10-minute walk or doing some yoga within your household or even using a treadmill at home. If you want to try and continue to protect yourself and not be exposed to the public, there are certain exercises that we can do within our own homes as well. The fifth, last but not least, is practice self-compassion. It is imperative that we remain patient with ourselves, give ourselves opportunity to feel difficult emotions. Not allowing ourselves to feel these emotions or telling ourselves that we should not feel a certain way can often make our distress worse. By accepting and acknowledging our difficult emotions, we often take power away from them. So taking some time to give yourself grace, being patient with yourself, and understanding that you are human and it's okay to be human. All of these things, when used in conjunction with one another or even singularly, can help us combat feelings of loneliness, can help us combat feelings of anxiety and depression, and can keep us mentally well. So thank you for your time. I want to wish everybody a happy Father's Day this weekend, and again, happy Juneteenth to all those who are celebrating.
Thank you, Luke, and happy Father's Day to you. So we are We are importantly needing to be paying attention to mental health. We also know that paying attention to physical health is critical, so my encouragement in addition to the mental health tips that you just got from Luke is to also pay attention to your physical health. Eating right, getting some exercise, making sure that you are sleeping are all also critically important. That'll give you some level of defense against getting ill. Even with COVID-19, staying healthier is a good thing to do. We also know that even with staying healthy and doing all those right things, we can still get COVID-19. It's an infection that can happen to any of us. We might do well if we are doing all those practices to have the strongest body possible, but we could transmit disease to others that have immunocompromised situations or are elderly. So it's important to remember that, yes, doing those things to stay healthy, eating right, getting exercise is critically important, but it's not enough in this disease. We also need to protect others that have situations where they can't be as healthy because they're older or because they have conditions and diseases that put them at risk. So pay attention, stay safe, and do those things to stay as healthy as you can. Please do stay tuned to our website and our social media for ongoing information. We are getting that updated on a daily basis, and we want people to know that there's good information at the website and also on our social media platforms. The website is covid19eauclaire.org. It does have all of our updated data, as well as those metrics that we are tracking over time related to disease and the capacity to respond to that disease. If there's information that you're not able to get at that website and you want to talk to someone more directly about a question, the COVID-19 call center number is 715-831-7425. If you call that number and leave a message, someone will get back to you right away. We will be back next week on Monday and on Wednesday, and we look forward to talking to you more then. And now I can answer some questions. Yes?
You were talking a little earlier about La Crosse and what they're seeing. Just seeing today 25 new cases for La Crosse County. Where is the difference between Eau Claire and La Crosse in regards to what's being done? Is it the fact that Eau Claire put in an order right after the stay-home order ended? Is it local businesses doing more? I guess, how is it that Eau Claire is seeing what they have and now La Crosse is seeing what they are?
Sure. So the question is related to the really large increase that La Crosse has seen in the last couple of days. 25 new cases reported today is what was described. I haven't looked at the exact numbers, but I'm assuming that that's correct. But I know that they're getting a large number of new cases. What's different between Eau Claire and La Crosse that we are not seeing those big spikes right now? It's, of course, very, very difficult to answer that question definitively. We know that we are doing a lot of work to make sure that people understand the risk and that they are following the basic premise of not spreading this disease quickly. It still can spread quickly, and La Crosse is seeing that. And it doesn't take much to spread. So one large gathering where people attend and spread to multiple people, and there's testing that happens following that, will identify cases. We have had a couple of outbreaks where it's very obvious that gatherings in close distance result in disease spread. So the more that happens, the more people have the fatigue of not wanting to pay attention to this, the more likely those events happen. It's difficult to know exact differences between La Crosse and Eau Claire. They've been doing some very intense testing in certain settings, and they are identifying disease that way. Again, I think the more testing we do when there is clear start of spread of disease, the more likely all of us will be seeing disease spread happening. Yes?
Yesterday, between Wednesday and Thursday, there was an increase in 9 cases for the health department. I think that's the biggest day-over-day increase that the county's ever had. You talked earlier about, were you expecting the county are you expecting more cases, jumps like that, 9, 10, 11 cases in a day scenario, in the next week or so?
Yeah, so the question is related to, are we expecting more jumps in cases as well. We did have a significant jump overnight between Wednesday and Thursday in our case numbers of 9 additional cases. So while we weren't with you yesterday, we would have been reporting yesterday that there was an increase of 9 cases. So in the last couple of days, we've had that 11 case jump. We are expecting increased cases. We are watching those numbers very carefully. We know that the community is interacting more. Our order has allowed that, and people are doing it. And that's happening in communities across the state. We are seeing increased number of cases across the state. It's not a surprise to us. Again, our goal continues to be to not have a large number of cases happen at any one time where we don't have the capacity to respond in a way that you all expect us to respond, both public health and healthcare. People want to keep disease contained. None of us want this disease. So our job in healthcare and in public health is to identify where disease is happening and keep it contained as much as possible and be able to respond in a way that if we get sick and we are one of those people that has severe outcomes from that illness, that we have someone to take care of us. So that's our goal. We do expect to see increasing cases, and we need the ability to respond happening. My hope is that we don't get the 25 cases a day that would tax our public health system at this point, but to have it happen more slowly and progressively. And that's partly why our order is in place. All right. Thank you, everyone, for being with us again today. We appreciate people listening. We want people to have good information. We know that there's a lot of information that circulates that isn't as clear and as accurate as it can be. So we really encourage you to go to websites and to access resources that provide you with that factual information. Our COVID-19 Eau Claire website is certainly one that we would encourage you to go to for local information, but also the State Health Department website and the CDC website are wonderful resources, and you can get links to those from our site. Again, thank you for joining us. Happy Father's Day to all the fathers out there, and we will be back on Monday.